Peptic ulcer disease is a common digestive condition that affects millions of people worldwide. It occurs when open sores develop on the inner lining of the stomach or the upper part of the small intestine. Recognizing the early warning signs is crucial for timely intervention and effective treatment. In this video, we'll explore the subtle and not so subtle symptoms that may indicate the presence of a peptic ulcer. By understanding these early clues, you can seek medical advice sooner and prevent complications. Let's begin by understanding what peptic ulcers are and why early detection matters. Peptic ulcers are most commonly caused by infection with Helicobacter pylori bacteria or the prolonged use of non-steroidal anti-inflammatory drugs, also known as NSAIDs. Other contributing factors include excessive alcohol consumption, smoking, and high levels of stress. Understanding the root causes can help you identify your own risk and be more vigilant about early symptoms. Now, let's move on to the first warning sign you should watch for. One of the earliest and most common warning signs of peptic ulcer disease is a burning or gnawing pain in the upper abdomen. This discomfort often occurs between meals or at night when the stomach is empty. The pain may last from a few minutes to several hours and can be temporarily relieved by eating or taking antacids. If you notice recurring abdominal pain, especially if it follows this pattern, it's important not to ignore it. Persistent pain is a signal that something may be wrong with your digestive system. Another early sign of peptic ulcer disease is a feeling of bloating or fullness even after eating small amounts of food. This sensation can make you feel uncomfortable and may be accompanied by frequent belching. Bloating is often overlooked, but when it occurs alongside other symptoms, it can be a valuable clue. If you find yourself feeling unusually full or bloated after meals, it's worth paying attention to, especially if it becomes a recurring issue. Nausea is another symptom that can appear early in peptic ulcer disease. You may feel queasy or have the urge to vomit, especially after eating. In some cases, vomiting may actually occur, and if it happens repeatedly, it's a sign that your digestive system is irritated. While occasional nausea can have many causes, persistent or unexplained nausea should prompt you to consider the possibility of an ulcer and seek medical advice. A noticeable decrease in appetite can be an early warning sign of peptic ulcer disease. You might find yourself uninterested in food or skipping meals altogether. This loss of appetite is often linked to the discomfort or pain associated with eating. Over time, this can lead to unintentional weight loss, which is another red flag. If you notice that you're eating less without trying, it's important to consider underlying causes like peptic ulcers. Unintentional weight loss is a symptom that should never be ignored. In the context of peptic ulcer disease, weight loss often results from a combination of reduced appetite, nausea, and pain after eating. If you notice that your clothes are fitting looser, or the number on the scale is dropping without any changes to your diet or exercise routine, it's time to pay attention. This could be your body's way of signaling an underlying problem like a peptic ulcer. Indigestion, also known as dyspepsia, and heartburn are common complaints among people with peptic ulcers. You may experience a burning sensation in your chest or upper abdomen, especially after eating spicy or fatty foods. This discomfort can be mistaken for acid reflux, but if it persists or worsens, it may be related to an ulcer. Pay attention to how often you experience these symptoms and whether they are triggered by specific foods or times of day. Frequent belching and excessive gas can also be early indicators of peptic ulcer disease. These symptoms occur as your digestive system tries to cope with the irritation caused by the ulcer. While occasional belching is normal, a sudden increase in frequency or intensity, especially when combined with other symptoms, should not be ignored. It's another piece of the puzzle that can help you recognize an ulcer early. Feeling unusually tired or weak can be an indirect sign of peptic ulcer disease, especially if the ulcer is causing slow, chronic blood loss. This blood loss can lead to anemia, which in turn results in fatigue, weakness, and sometimes shortness of breath. If you're experiencing unexplained tiredness along with other digestive symptoms, it's important to consider the possibility of an ulcer and consult a healthcare professional. One of the more serious warning signs of a peptic ulcer is the presence of dark, tarry stools. This can indicate bleeding in the stomach or upper intestine as the blood is digested and turns the stool black. If you notice this symptom, it's important to seek medical attention immediately, as it may signal a bleeding ulcer, which can be life-threatening if left untreated. Vomiting blood, also known as hematemesis, is a serious symptom that may occur if a peptic ulcer begins to bleed. The blood may appear bright red or have a coffee ground appearance. This is a medical emergency and requires immediate evaluation. If you ever experience vomiting blood, do not delay in seeking help, as it can quickly become life-threatening. Recognizing the pattern of pain is key in identifying peptic ulcer disease. Typically, the pain is located in the upper abdomen and may radiate to the back. It often follows a predictable pattern, worsening when the stomach is empty and improving after eating or taking antacids. Keeping a diary of your symptoms, including when and how they occur, can help your doctor make an accurate diagnosis. Peptic ulcer disease can also affect children, though it's less common. In kids, the symptoms may be less specific and can include general abdominal discomfort, nausea, and poor appetite. Children may not always be able to describe their pain clearly, so it's important for parents to watch for changes in eating habits, unexplained irritability, or complaints of stomach pain. Older adults may experience different or less pronounced symptoms of peptic ulcer disease. Sometimes, the only signs are vague discomfort, fatigue, or anemia due to slow blood loss. Because symptoms can be subtle, ulcers in older adults are often diagnosed later, sometimes after complications have developed. It's important for seniors and their caregivers to be aware of these less obvious warning signs. If you experience any of the warning signs discussed, especially severe or persistent abdominal pain, vomiting blood, or black stools, it's crucial to seek medical attention promptly. Early diagnosis and treatment can prevent serious complications such as bleeding, perforation, or obstruction. Don't wait for symptoms to worsen. Timely intervention can make all the difference in your recovery. Understanding your risk factors can help you stay alert for early warning signs. Common risk factors for peptic ulcer disease include a family history of ulcers, frequent use of NSAIDs, smoking, excessive alcohol intake, and chronic stress. If you have one or more of these risk factors, it's especially important to monitor for symptoms and discuss your risk with your healthcare provider. Helicobacter pylori, or H. pylori, is a type of bacteria that infects the stomach lining and is a leading cause of peptic ulcers. Many people with H. pylori infection have no symptoms, but when ulcers develop, early warning signs can appear. Testing for H. pylori is simple and can be done through breath, blood, or stool tests. If you have symptoms of an ulcer, your doctor may recommend testing for this infection. Non-steroidal anti-inflammatory drugs, or NSAIDs, are commonly used for pain relief but can irritate the stomach lining and increase the risk of ulcers. If you regularly take medications like ibuprofen or aspirin, be aware of the potential for developing peptic ulcer disease. Early symptoms may be subtle, so it's important to monitor for any digestive discomfort and discuss alternatives with your doctor if needed. While stress alone doesn't cause peptic ulcers, it can worsen symptoms and slow healing. Lifestyle factors such as poor diet, lack of sleep, and high stress levels can all contribute to digestive discomfort. Managing stress through relaxation techniques, regular exercise, and healthy eating can help reduce your risk and improve your overall digestive health. Smoking and excessive alcohol consumption are both risk factors for peptic ulcer disease. Smoking impairs the stomach's ability to protect itself from acid, while alcohol can irritate and erode the stomach lining. If you smoke or drink heavily, consider reducing or quitting to lower your risk of developing ulcers and to support your digestive health. If left untreated, peptic ulcers can lead to serious complications such as bleeding, perforation of the stomach wall, or obstruction of the digestive tract. Early warning signs of complications include sudden, severe abdominal pain, vomiting blood, or passing black stools. Recognizing these signs and seeking immediate medical attention can be life-saving. Diagnosing peptic ulcer disease typically involves a combination of medical history, physical examination, and diagnostic tests. Your doctor may recommend an upper endoscopy, which allows direct visualization of the ulcer, or non-invasive tests for H. pylori infection. Early diagnosis is key to effective treatment and preventing complications. Treatment for peptic ulcer disease usually involves medications to reduce stomach acid, antibiotics to treat H. pylori infection, and lifestyle changes. Early intervention can lead to complete healing and prevent recurrence. If you suspect you have an ulcer, following your doctor's recommendations is essential for a full recovery. A healthy diet can support ulcer healing and reduce symptoms. Focus on eating balanced meals, avoiding spicy or acidic foods that may trigger discomfort, and limiting caffeine and alcohol. Eating smaller, more frequent meals can also help manage symptoms. Always consult your healthcare provider for personalized dietary advice. Regular follow-up with your healthcare provider is important to ensure that your ulcer is healing properly. Your doctor may recommend repeat testing or endoscopy to confirm healing, especially if symptoms persist. Staying in touch with your healthcare team helps catch any complications early and ensures the best outcome. Preventing the recurrence of peptic ulcers involves addressing the underlying causes, such as eradicating H. pylori infection and avoiding NSAIDs when possible. Maintaining a healthy lifestyle, managing stress, and following your doctor's advice are key steps. If you have a history of ulcers, be proactive in monitoring for early warning signs There are many myths about peptic ulcer disease, such as the belief that spicy foods or stress alone cause ulcers. In reality, most ulcers are due to H. pylori infection or NSAID use. Understanding the true causes can help you focus on effective prevention and treatment strategies rather than relying on misconceptions. A family history of peptic ulcer disease can increase your risk of developing ulcers. If close relatives have had ulcers, it's important to be especially vigilant for early warning signs and discuss your risk with your healthcare provider. Early awareness can lead to prompt diagnosis and better outcomes. Peptic ulcers can sometimes be confused with other digestive conditions, such as gastritis, acid reflux, or gallbladder disease. If you have persistent digestive symptoms, it's important to get a proper diagnosis. Your doctor can help distinguish between these conditions and recommend the right treatment. Women may experience peptic ulcer disease differently than men. Hormonal changes, pregnancy, and certain medications can affect symptoms and risk. Women should be aware of the early warning signs and discuss any unusual digestive symptoms with their healthcare provider, especially during pregnancy or menopause. Men are slightly more likely to develop peptic ulcer disease, especially if they have risk factors like smoking, heavy alcohol use, or frequent NSAID use. Men should pay attention to early warning signs and seek medical advice if they notice persistent digestive discomfort or pain. As people age, the risk of peptic ulcer disease increases, partly due to more frequent use of medications like NSAIDs and changes in the digestive system. Older adults should be especially vigilant for subtle symptoms and report any digestive changes to their healthcare provider promptly. Chronic illnesses such as diabetes, liver disease, or kidney disease can increase the risk of peptic ulcers and complicate their management. If you have a chronic condition, it's important to be aware of early warning signs and work closely with your healthcare team to manage your overall health. Certain medications beyond NSAIDs, such as corticosteroids or anticoagulants, can also increase the risk of peptic ulcer disease. Always inform your doctor about all the medications you are taking, and ask about ways to protect your stomach if you need to use these drugs long term. While diet alone doesn't cause ulcers, certain foods can trigger or worsen symptoms. Spicy, acidic, or fatty foods may increase discomfort, while a balanced diet rich in fruits, vegetables, and whole grains can support healing. Listen to your body and avoid foods that make your symptoms worse. Preventing peptic ulcer disease involves a combination of healthy habits and risk factor management. Wash your hands regularly to reduce the risk of H. pylori infection, avoid unnecessary NSAID use, limit alcohol and tobacco, and manage stress. These steps can help protect your digestive health and reduce your risk of ulcers. Living with peptic ulcer disease can affect your mental health, leading to anxiety or depression, especially if symptoms are persistent. It's important to address both physical and emotional well-being. Seek support from friends, family, or mental health professionals if you're struggling to cope with the impact of ulcers. Regular physical activity can support digestive health and help manage stress, both of which are important for preventing and managing peptic ulcer disease. Choose activities you enjoy, such as walking, swimming, or yoga, and aim for consistency rather than intensity. Always consult your doctor before starting a new exercise routine. Getting enough restful sleep is important for overall health and can aid in the healing process for peptic ulcers. Poor sleep can worsen stress and digestive symptoms. Establish a regular sleep routine, avoid eating right before bed, and create a relaxing bedtime environment to support your recovery. Staying well hydrated is essential for digestive health and can help reduce irritation in the stomach lining. Drink plenty of water throughout the day and limit caffeinated or sugary beverages. Proper hydration supports healing and overall well-being. Routine medical checkups can help detect peptic ulcer disease early, even before symptoms become severe. Regular screenings and open communication with your healthcare provider are key to maintaining digestive health and catching problems before they escalate. Keeping track of your symptoms, diet, and lifestyle habits can help you and your doctor identify patterns and triggers for peptic ulcer disease. Use a journal or app to record your experiences and share this information during medical visits for more personalized care. To recap, early warning signs of peptic ulcer disease include burning abdominal pain, bloating, nausea, loss of appetite, unexplained weight loss, indigestion, belching, fatigue, and signs of bleeding like dark stools or vomiting blood. Recognizing these symptoms early and seeking medical advice can make a significant difference in your health and recovery. Being aware of the early warning signs of peptic ulcer disease empowers you to take charge of your health. If you notice any of the symptoms discussed, don't hesitate to reach out to your healthcare provider. Early intervention leads to better outcomes and helps you maintain a healthy, active life. Stay informed, listen to your body, and prioritize your well-being.